Now, the thing I say to people is, I don't heal you, your body heals itself. I'm a facilitator that helps you to make your body heal itself, because you just don't have the power to heal somebody.
Hi, Andrew.
Hi, thank you for having me on.
Thank you for coming. So can you introduce yourself? Tell me where you're working, what are you doing there, and what's your degree?
Okay, I work at the Willows Clinic. I'm Andrew Smith. I do multiple therapies. I started off as a masseur, then a sports masseur, sports therapist. Then I trained with the FA in the UK as an FA physiotherapist, so that I could work with multi-million-pound players. I met Irene on the colonic course. So we're both colonic hydrotherapists, but I don't practice.
Okay.
I found when I came to Ireland, although I had a big practice in the UK, Irish women didn't want to come to a man.
Okay, go on.
So I went back to doing injuries. But when I was in the UK, I had my own clinic. I worked from 1995 to 2005 for Carlton Television as a therapist in Nottingham and Birmingham.
Well done.
And at the same time, I also worked at Notts County as part of the Club Physiotherapy staff. Went in for 2 weeks and stayed for 4 years.
Oh, it's usually happened, yeah.
So I gained a lot of experience, and when I met Irene, I moved over from England to Ireland.
This was a hard decision?
No, not really. No, it wasn't a hard decision at all.
But it's kind of a big movement from England to Ireland, and just because of love, or you had some business here too?
No, it was because I'd met Irene, but things had changed in England. I had left Notts County for health reasons more than anything.
We will not tell the truth. We'll tell her that's only because of love.
Yes. And also Carlton Studios had closed in Nottingham and Birmingham.
Okay.
So, but it was, we'd been together. I'd been coming over 2 days a week by then for a couple of years. And basically, I moved over full time.
Okay, fantastic. And so you how long are you together then? Since when you moved?
I moved full time here in 2005.
Okay.
But I've been coming for 2 years from 2003. Okay. So all in all, I've been around for 21 years.
Yeah, wow.
But
long time.
It is. It's a long, long time. 33 years as a therapist.
Yeah.
20 years before that on the coal faces in the mining industry. Because I came into this because I tore my rotor cuff out of my right arm, and I was told I'd never do a physical job again.
Wow.
But then I was told by my physio, who was leaving the NHS, that it isn't that, it's just time. They won't give you the time to recover it.
Okay.
He fixed my arm, and then he taught me to be a masseur and a sports masseur, and so it grew from there. And basically, these days, I tend to stick with lymphatic drainage, the Perrin technique, and basically working with ladies that have had they're coming to me for post-operative surgery, for tummy tucks, breast lift, the occasional Brazilian butt lift. But, I also do acupuncture, do clinical acupuncture, auricular acupuncture, and facial rejuvenation acupuncture.
Oh, fantastic.
So, but my main thing is the Perrin technique. That is the most important thing to me.
Okay, so tell more about that. Explain, because, for example, I don't really understand what is that. So explain us, as for people who not involved in this field at all, what is for, how does it work, and what main things, from your point of view as experienced guy, important to deliver to us who just thinking, oh, what is that?
Okay. The Perrin technique is a technique that was devised by Dr. Raymond Perrin in Manchester 35 years ago.
Okay.
And it is for treating ME, chronic fatigue, fibromyalgia, and lately long COVID.
Interesting.
What it is triple treatment of lymphatic drainage massage, cranial sacral therapy, and spinal mobilization when necessary. We also use some amount of supplements. This technique itself is all done in one treatment. It's a very, very in-depth thing. Okay. It's a thing where you don't treat symptoms. Okay. I got involved with it because my son, Daniel, he got ME when he was 19. He had glandular fever twice in 6 months. Oh, wow. Didn't recover the second time. And so we tried everything for years to try to get him better. And all they were doing were pushing antidepressants because the big thing was with ME, or as it was originally called, yuppie flu, they said it was in your mind.
Yes.
It didn't exist. That isn't true. It does exist. It's now proven to exist. Yeah. Ray's big thing was that it was to do with neurolymphatics, and basically that couldn't be proved because if you read any medical textbooks, there is no lymphatics in the brain. But having said that, 6 years ago, Georgia State University Medical School was scanning for dementia, and they came out and said, wow, there's lymph in the brain. It drains along the ganglia, which is exactly where Ray had said it 30 years before.
It's never been proved that time.
But it couldn't be proved. But now it's proved. And Ray's worked quite a lot with Georgia State University. And it's getting more and more accepted that these things come through neurolymphatic problems. Okay. So when somebody comes to me for the first time, some people will have a diagnosis of ME, chronic fatigue, fibromyalgia is a big one. But now long COVID again, there's a lot of stuff around this that says long COVID doesn't exist.
Yes,
but it does.
Yes,
it runs very much like ME. It is very much the same, and you find with the people, because you just can't treat symptoms, you have to treat the person.
That's true, actually.
You have to treat the person, because what we do is we go back to birth.
Okay.
And we find out how old the person's mother was when they were born.
Oh, really? It's affected?
Yes.
Oh, wow.
What sort of pregnancy it was, what sort of delivery it was, whether they were breastfed. Big point, breastfeeding. It is the best way. But if you're the first child, you're going to get all the toxins from your mother.
Okay.
All the mercury that's in the teeth and everything else will pass through.
I didn't know that. Wow. To the first child?
Yeah. To the first
Only?
Well, it'd be a little bit to the second child, but
it's mostly
it does get past toxin.
Oh, wow.
So it's an important thing for us to know whether they were breastfed or not. Another big thing that we need to know is, did they suffer tonsillitis?
Okay.
Because the tonsils are part of the lymphatic system.
Yes.
Did they have sinus problems? Because for the brain to drain, it has to be able to get through the cribriform
I'm just memorizing in my head. Yeah.
So basically, all these things are important. So we need to know what they had, what the birth was like. Were they a sickly baby? What, up to the age of 13, what sort of things happened?
Okay.
What happened emotionally in their life? What illnesses they've had? What operations they've had? What accidents they've had? Because they are all things that can affect you in later life. They sit in your body, and they can affect you in later life.
I wouldn't think about that.
No, this is it.
Unless you come across a situation when you need to look at your health issue,
Yeah.
Wow.
Then you'll go from the teens to the 20s and then right through the life. And basically what you tend to find with ME, chronic fatigue, fibromyalgia is basically there's been a build-up of stress, there's a drainage problem, but things have happened through the life that have been little things until you reach the point where you get to the final straw that breaks the camel's back.
Right.
And then they go over into ME, chronic fatigue, fibromyalgia, and spiral down. And then you've got to help to bring them back. Now, the thing I say to people is, I don't heal you, your body heals itself. I'm a facilitator that helps you to make your body heal itself, because you just don't have the power to heal somebody.
Wow. That's very interesting. So basically that's you and the clinic helping people with this condition.
Yes.
Okay. And how many people, for example, you'll have in a year approximately? Give me just randomly figure from your kind of. I know you maybe never count them, but just.
Yeah, you're talking.
No, but okay, count maybe divide 4 months. 4 months. Go 4 months first, and then we approximately just.
You see, the problem with counting that is the minimum treatment is 12 weeks.
Okay, 3 months. Okay, for 3 months, how many people you will have, for example?
Well, at the moment, I'm running 35.
35. 35. Okay.
And I've been doing this for 17 years. So I have seen hundreds of people over time. And with those people, some people you can help.
Okay.
Some people you can't. The people that will do what you ask them to do
you can
will
help
get better.
Them, of course, yeah.
Some people don't, and they don't get better. And basically, it is a long road. There's no magic bullet. Once you've built up over the years and then you've gone over the edge, then there's no magic bullet that's going to get you back straight away. There's no pill that anybody's going to give you that is going to make you better.
Yeah.
You need to look at your lifestyle.
As well, see lifestyle, nutrition probably too.
Yeah, I mean, omega-3 is very, very important for recovery, because there's a little area in the brain that is affected by ME, and it's about the here. And what happens is there was Professor Basant Pure that was at the Breakspear Clinic in England, and basically he did a study and he scanned people with ME for 6 months, and this area, if you saw it, it became like a penny that grew into the size of a penny, and he put them onto a really good omega-3, and over 6 months it closed again. But you have to ask people to stop drinking alcohol, because alcohol affects the same part of the brain.
Oh, wow. So, people, don't drink alcohol if you're not sure if you have any health issue. Even if you don't have any, don't drink much.
Yeah. So that's it. It's, that's one of the things that you have to look at.
Okay.
But it is a thing where you have to build it all. Every week you have to do the massage. You have to do the craniosacral when necessary. You're looking to mobilise the spine as well, because people get blockages in the spine. And
does it happen often?
What, the blockages in the
spine? Yeah,
pretty much.
And what are the symptoms for that?
Okay, when you're doing the first consultation, you will go right the way through that I was talking about before. Then we do another thing to see how many out of the top 50 symptoms people have got, and then we look at a multiple choice questionnaire which tells us about the sympathetic and autonomic nervous systems and how they're working. And then we do a full physical examination looking for raised lymph nodes, lymph ducts, blockages anywhere in the body. And basically a big area that is really important is the chest, because all lymph drains to the subclavian veins.
Yes, there, yeah.
And if it's blocked here, then it can't drain this way, and it can't come up here. So you find that there's like varicose veins in this area,
the chest,
where the lymph ducts are trying to get up. And lymph ducts have non-return valves like a vein. And like varicose veins, if you get a lot of pressure, the valve collapses and the fluid runs back, and that causes a bulb on a varicose vein. So basically it's the same thing, and you can actually feel it. and you will find the chest has lots of little lumps in it with engorged lymph nodes. So it's very important to get the drainage going over the chest. Massive important area to get it cleared through.
And you can do this.
Yeah.
Wow.
And
People, remember this, men, if you have any such lumps, make sure it needs to be treated.
I know. I mean, it's quite strange because I've actually had women come to me because they have got lumpy breasts and they're very sore, and they've got no people that have had the treatment with us for the ME, and they come in and we teach them the massage at home and we do the massage for them. And I mean, we've got one lady that has had loads of operations to have lumps taken away, and after 6 weeks she got clear breasts just by doing the massage. So, you know, it is an important thing. And it's an important thing if you get any lumps, you go to your doctor as well and get them checked first.
Yeah.
But going back to the spine, yes, in the spine you'll get where the spine should come out and come back in again. It will flatten just between the shoulder blades and it will collect.
It will cause the pain.
Yeah, it will be painful, but it will also collect lymph. It will block it. And you'll feel a definite, if you put your hand to the base of the spine in that area, you'll feel a difference.
You will feel that, but how the person will feel that he has this blockage?
They won't.
They won't. Only if they go to see a specialist, they can find out. Okay.
Yeah.
So I can see you brought some leaflets there. So can you explain what is...
What I brought with me, just because I knew we'd be talking about this, is it's just a diagram of the lymphatic
That's fine.
system.
People probably need to know this as well. So
your lymphatic system, it goes all the way through your body. It's a very neglected system as it happens. But what it does is super important because it collects all the debris from your body, and basically it picks up all the dead cells, all the stuff from your body, brings it up through the lymph nodes to try and cleanse it if there's any infection there.
Okay.
All the way up till you come to the subclavian veins, where it drains down to the heart. The heart passes it to the liver and kidneys. The liver and kidneys then cleanse it. The lymph goes back on its circuit around the body, and the waste products are excreted away. If your lymphatic system packs up, you're dead within 48 hours.
Oh, wow.
Your body will poison itself.
So, advice. What type of advice need to give to people how to look after your lymphatic system to be healthy?
Okay. Skin brushing, that's a really important thing.
Okay.
You always brush towards the heart because you're bringing the lymph off.
From the toe to the up.
Yeah, upwards. Skin brushing is an easy thing that you can do.
Okay.
You can actually do
How often? Once in a week and a half, or you have to do it every day?
No, I would do it at least once a day.
At least once a day, okay.
Yeah, if you think there's something wrong with your lymphatic system, do it once a day.
It's no harm, anyway, to do as often as possible.
No, it's not, because you're stimulating lymph. It's good for your skin.
Okay, as well as the...
Yeah, gets microcirculation going and everything else, so it is good for you. Basically, the other thing they can do is a big thing that's really helpful is a head massage. I'm going to take my glasses off to show you this.
Go on.
So I'll move a little bit. And basically what you do is you put your hands to the top of your head and come all the way down onto your neck 20 times. Come from the top of your head down onto your neck 20 times.
And does it shower or just when you're sitting on the
No,
sofa?
when you're just sitting. And just
like
from
this.
the top of your head down the back of your neck.
Okay.
And then come down your neck and just bring it to your collarbone.
Did you have to keep pressure?
Just a very light pressure. We're not trying to massage and squash the muscles. We're just trying to get the lymph moving.
Okay.
And that will be enough to help your brain to work more efficiently.
That is fantastic, yeah. So it will help people just to start lymphatic system work properly.
That's it, from the brain.
From brain go down, to rid off, basically.
Because, I mean, if you start to get a build-up of lymph in your brain, stagnant lymph, then it starts to affect the autonomic and the sympathetic nervous systems.
Yeah.
And then you're starting to send the wrong messages to different parts of the body. So the organs aren't working as well as they should, and then people are getting tired, they're getting really run down because all the wrong messages are being sent out. And it's
Wrongly, okay. It's basically stuck, so it can't go circulate properly around the body. It's the way it should be.
Yes, that's it. The lymph needs to be flowing properly.
Okay. Can you give an example, the worst scenario that you come across in your practice with person with lymphatic system that's been locked up completely? What the worst episodes you can describe?
We've had people that are completely bedridden.
Oh.
And they just can't get out of bed. And my own son was at that point when we found Ray Perrin. And Ray liked my background, so he asked me to train. He also asked me to do England 2 days a week, even though I was living over here, which was great because it meant I got Daniel better.
Okay.
So, because I was supposed to do it for 6 months, I did it for 2 years, but I got him better. So it's people that are bedridden. We've had young ladies, especially ladies. You seem to see an awful lot more women than you do men with these illnesses.
Why?
Well, there is some evidence to show that it will pass from mother to daughter.
Oh, go.
So you very often, when you're doing these questionnaires, you will ask, has anybody else in your family had this sort of thing?
Okay.
And Granny had her aches and pains, which would probably be undiagnosed fibromyalgia.
Actually, it's true. Nowadays, it's, yeah.
So there is some evidence that it does pass down through the female line.
Okay.
But it is sort of very... It's bad. Everybody's different. I treated a family of 5.
Yes, but we're all different. But at the same time, so if you give example of the patient that you come across that you never maybe saw in your life, such problematic lymphatic system that you need to maybe work longer, or the lymphatic system doesn't respond to your treatment, or you eventually has to send or refer this patient to the doctor or any kind of, what the worst things happened if the lymphatic system stopped working properly?
Okay, well, from personal point of view, I always find I'm the last one in line. They've seen everybody else. They've done everything else by elimination, and they don't know where else to go, and then they come to us.
Okay.
And then basically, we've got them with us. That's not to say we don't say, I want you to go off and have a scan.
Mm-hmm.
I want to see what's happening in your brain. It could be that they don't need anything else but craniosacral therapy. Now, the thing that I haven't mentioned is I'm the only parent therapist in Ireland, and I've been for 17 years.
Okay.
So whereas the Perrin technique has gone from when I first started as being very localised to England, it's worldwide now.
Okay.
I mean, my furthest away client came from New York.
Oh.
And she came for 3 months. And I treat people from all over the country. People come to me from North and South Ireland, from all over the country. So...
You're so good. You have good reputation. That's why.
It's that, and the fact that there's only me. They've got no choice.
Yeah, I know. But, people will talk about you. That's why they're back to you all the time. So it's very important.
Yeah.
You will not get so many clients back, came from New York, for example, who just randomly pop in and said, okay, I'll be stay with this gentleman because whatever, good review. But if they have a good review from the client, they definitely look back and even came from New York to see you.
Yeah, she came back a couple of weeks ago, didn't she? And she just wanted me to check. She was visiting family. She wanted me to check how
Well
she
done.
was. So, but no, I mean, the hardest ones for me are children.
Okay.
When you get a child that's got it.
Yeah, it's a difference.
It's massive. It's like with the long COVID. It's the same thing. And we can turn people around so quickly. In the NHS,
It's locked up.
it's so... getting so well known now in the UK that the NHS have just run tests to see how it will work with long COVID. And as a result of that, there will be a video coming out very soon on YouTube that people can watch, and where I've just done part of the massage for the lymphatics, the whole treatment will be shown so that
well done.
other practitioners, it's not me that's done that.
I know, still,
it's Ray Perrin that's actually done it.
It's from your field you're talking about,
but
yeah.
It's come through agreement with the NHS because they are saying that this is the treatment that people should be doing.
Yeah.
And basically, it will show people how to do it at home so that they will be able to look after the lymphatics.
So lymphatic system then works in our body as detoxination, I would
That's
say.
it, yeah. It is detoxing your body.
Yeah.
And it's very, very important and very overlooked.
So you talk about that you do some lymphatic, it's LPG called type of massage. Is this correct?
Yeah.
So do you use the machine or you do it manually?
No, I do it manually.
Manually.
Yeah, we do it manually, and then we do the cranial therapy to help to get the toxin running away from the head.
Yes, yeah.
So you're working around the head and the sacrum so that you're making the whole body go.
Yeah.
So you're getting that spine nice and clear, and then we might mobilise the spine if there is a flattening in it. Not everybody has the flattening, but most people do.
Most yes, do.
And we just get them going again. And it can be a long road. I've had people that have been with me. I had one young lady with me. She came to me in a wheelchair.
Oh.
And it took me 5 years before she was better. But she's gone on.
5 years, long term.
Yeah, she's gone on. She's gone to university. She's done a degree.
So would you say she's recovered then?
Oh, yeah.
Completely?
Yeah, she's...
Well done. That is actually that you have to talk about this. And this lady was on the wheelchair. When she came first time to you, what condition, which level of that condition she used to be?
Well, we have a scale that when we do the questionnaires and the medical examination and we put it all together, we have a score from 0 to 10. 0 being completely bedridden, 10 being completely well. Okay. And she went from a 1 to basically a 9.5.
Okay.
It's very difficult for anybody to hit a 10.
Right, okay.
Everybody's got something.
Okay. So, and after 5 years seeing you and do this manual therapy with you, so she's basically recovered and back to normal life?
Yeah.
Even she's still on the wheelchair, I presume? Or
No.
She stopped using wheelchair even?
Yeah, stopped at the...
Oh, that is amazing result. Even 5 years will worth it.
No, it's, I think, probably within the first year we got rid of the wheel.
Can you call her name?
No.
Okay. That's fine. It's okay. I'm just wondering just...
No, I can't.
No, well done. Anyway, Andrew, it was nice to see you. Thank you very much for coming. I would love to see you again because I think we have so many topics that we need to cover.
Yeah.
With the magic hands. I can call this way now.
Yeah.
Thank you very much.
Thank you.